Hello, everyone, and thank you for joining PQA's Quality Forum webinar today. My name is Amanda Ryan, and I am PQA's Director of Education. Our topic today is the Pharmacy Quality Solutions 2020 Industry Trend Report in Pharmacy Quality. Before introducing our speakers, I would like to call your attention to 3 housekeeping items. First, attendees are encouraged to ask questions during the presentation. We have the question panel available for you, and it's located on the right side of your screen. At the conclusion of the presentation, as time allows, I will read the questions aloud during the webinar for our speakers to answer. Second, the webinar recording and the slide deck will be available to PQA members within the week following the presentation, and that will be in the members resources section of the PQA website. And then finally, I would like to encourage all attendees to complete the quick 1-minute survey that appears at the conclusion of the webinar, and we do very much value your feedback. It is now my pleasure to introduce today's speakers. First, we have Todd Sega. He is the Senior Vice President of Development and Strategy at Pharmacy Quality Solutions. He oversees relationships with payers and pharmacy organizations that partner with PQS to manage performance information and to optimize the quality of medication use. Todd has a passion for quality improvement and, more specifically, helping patients receive the best care from network pharmacies. Todd believes the first step to quality improvement starts with solid measurement. He enjoys working with and leading organizations through a process of understanding, engaging, and eventually managing performance information and deploying a portfolio of improvement strategies and programs. Also with us today is Emily Endres. She is the Vice President of Client Services for PQS. She leads a team of seasoned and highly regarded account managers, and her team works diligently to support community pharmacies, health plans, and pharmacy benefit managers with quality improvement strategies and initiatives by using the vehicle of quality measurement to drive performance results in the form of increased health and well-being for patients. Emily has served the pharmacy industry for over 18 years in a diverse career that includes many years of work in community pharmacy, managed care contracting, and quality improvement strategy. Todd and Emily, we would like to thank both of you for being here with us today. And with that, Todd, I am going to pass control over to you to go ahead and get us started. Are you able to advance the slides?
Sure, yeah, shouldn't be a problem. Thank you, Amanda, I appreciate that. And welcome to all of you. I hope it's a little sunny where you're at and enjoying that. We appreciate you taking the time out of your afternoon to spend with us. And Amanda, if you don't mind, I think it didn't move for me, but I'll try clicking once more if you can try on your side. There we go, that should work. Well, thanks to all of you. I appreciate that. And I just wanted to cover what we will cover on the presentation here today, and then I'll hand it over to Emily to share some thoughts on a couple of the other sections of the trend report. So for us, we always like to start with why. We'll cover that for some of the background for our trend report and the key components to the trend report that we'll have for the 2020 trend report. And then we'll share a brief update for what we'll be up to for the 2021 trend report as well. So for 2020, we did capture our more so qualitative feedback from various industry partners and patients. So we actually launched with a consumer perceptions with some market research and perceptions of consumers on pharmacist-provided care and services. And then what we won't cover today, but is available in that report, if you were to download it and take a look, we actually did a breakout about May or April of last year in looking at comfort levels of consumers for treatment, and then also testing for COVID-19. So there's some interesting takeaways there and just wanted to call that to your attention. The second section within that trend report for 2020 is also a pharmacy readiness assessment for outcome-based measurement, and then also payer challenges and opportunities with performance improvement. Then of course, we like to give a little teaser, so we will share a little bit of what we're thinking about, and then also looking for some ideas from you as well. And we'll share an easy way for you to share your ideas with us for some different data-driven insights that we can get to for our 2021 report. So with that, we always like to start with our why, and it really is because we've learned in our specific role as a neutral third party in the industry over the past several years, we hear a lot of different languages being spoken. Some of those languages are defining value or what's important to one stakeholder that may not necessarily map to something of value for the other. And if we really zoom out even further and think about pharmacy being such a broad profession, we've learned that there are different languages among health system pharmacists for sure, managed care pharmacists. So each segment seems to have their own language. So one of the things we wanted to do with the trend report was to try and standardize that language, at least for a component of the marketplace that we're in, to get some understanding across the board among those different stakeholders. And then we also do a lot, but it doesn't usually leave our own four walls. And what I mean by that is what we publish. So we have a lot of research. And I think as an industry, we probably have more pilots than United and American Airlines combined. So we do a lot of that research, but does it really leave our own journals in peer-reviewed journals, and does it make it to broad stream media? Not so often. So we thought that the content here is something that can easily leave our four walls and others can sort of see where the marketplace is heading. And that was another observation that we had. And we also are constantly thinking about what new approaches we can take, but how often are we really checking in with the patients and consumers about what they see as the future? So these were some of the why statements that really went into the genesis for why we had created the trend report. And what I'd like to cover now is how we are approaching the trend report at PQS. This was really the second year that we've done the trend report. So we don't have many years behind us with a lot of experience to know what we may pick up on for trends. So we approached it in a very similar way, whereas the very next year, we did this more qualitative survey-based approach to the trend report. And we found some interesting variations, not a lot, I would say, but we asked a couple of different questions to dig a little bit deeper to understand why consumers may have certain beliefs or perceptions more so than what we did last year. So because we didn't see as much variation in some of the base or core questions, what we're going to do is focus it for even years to do that more qualitative survey-based approach. And then what we'll also look at then is the data-driven insights, which that's what we'll be up to this year. And we'll share some highlights at the very end of the presentation. So because of our learnings over the past 2 years, this is how at the current time we're planning on spacing out the efforts and what we bring to light through the trend report. Of course, we want to thank all of our committee members, and we try to have a broad representation. So we do have, starting with Ann Burns at the American Pharmacists Association, all the way down through Kim Caldwell from PCMA, trying to get the perspectives of various associations. New this year, which we certainly appreciate, was Sheila Arquette. So we wanted to make sure we weren't leaving out some of the thoughts and mindset of those within the specialty pharmacy space as well. So that was a new addition. And then of course, special thanks to our research partners as well to help make all of the analysis and synthesizing this possible. But a special thanks to those committee members to help us get there. So as I mentioned, we will start off with section 1. Always want to put patients first. So we wanted to understand those consumer perceptions of pharmacist-provided care, and not to go into all of the details about the approach, but just on a very high-level approach so you understand what type of individuals we were looking for and who ended up responding to the survey. We did target a large panel across the entire country that was somewhat representative of the entire population. So we had individuals in the Southeast, the Northeast, Midwest, South, West, depending on how you define it. But we did have a pretty geographically diverse population that responded to the survey. They did have to be 18 years of age or older, and we asked that they would have at least visited the pharmacy once within the past 12 months in order to essentially get into the survey as a filter question. We ended up needing to send this to almost 2,500 individuals to end up hitting our target of roughly 1,000 completions. So we were just under that. And an interesting note is that for 2019, I think we ended up having 1,001. So it was very consistent for that 1,000 target that we were going for. And we did collect some other demographics, which we won't cover all of the various ways that we stratified the analyses in this presentation, but we did list a lot more of those demographic differences in the full trend report itself. So we did collect some of that information as well. So to start off, where we had wanted to gather some information was relating to just the type of pharmacy that the consumers were using or saying that they would use or stop into most frequently, and then how comfortable they were with receiving vaccines, and then have they even ever received a vaccine at a pharmacy. And we started to look at that in a few different ways, and it was interesting. So this first slide is really just looking at the utilization or the type of pharmacy that those users reported going to within the past 12 months. And we don't see a lot of difference between 2019 and 2020, to my earlier point, except one unique thing was in 2019, we did not have any respondents listing mail order. But for 2020, we did. So it wasn't that it wasn't an option for them to select. It just so happened that in the panel that was used for 2020, there were more respondents who now selected that. So because of that, there might be some dilution in the other types of pharmacies they could have reported. I don't think it's necessarily something that's representative of the entire population to say that there's a shift in less individuals going to, let's say, a grocery store or pharmacy among those who are 18 to 34 that you see on the bottom left. But the age categories that we broke down, as you can see, 18 to 34, 34 to 64, I'm sorry, 35 to 64, and then 65 and older. So you do see a little bit more of the mail order in 2020 compared to 2019, especially for those that are 65 or older. And then you do see a pretty consistent base for those reporting retail chain, and a little less, as I reported earlier, for grocery store with pharmacy. But similar trends with across the board at the various pharmacy types, just so you knew how they were bucketed. And in the survey, we did list examples of these types of pharmacies, not knowing that consumers at scale probably aren't familiar with the term mass merchant. So we did list some examples so they were more familiar with the terms that were used. So here's where we wanted to understand a couple of things. One was their use or reported use of receiving a vaccine at a pharmacy in the last 12 months, yes, but greater than 12 months ago, and then never at a pharmacy. So as we start on this particular slide, we'll really start and work our way horizontally. So you can see, yes, within the last 12 months, and knowing that our sample sizes were roughly 1,000, it makes it pretty easy to do the math there. There was a higher percentage of respondents in 2020 that reported receiving a vaccine in the last 12 months compared to 2019. So you can see it was about a 6% increase with 443, so about 44% compared to 50% in 2020. And then that's a little bit of water in the balloon. Let's take a look over to the far right. So it did have a decrease in the percentage of respondents that said that they have never received a vaccine at a pharmacy, and that remained relatively consistent among those respondents stating yes, but more than 12 months ago. So that was nice to see. And I think one thing that'll be really interesting for us as we look to do this same approach in 2022, as I mentioned, is simply because of the pandemic and those pharmacies really representing the groundswell of vaccination opportunities for patients. It'll be interesting to see how some of these have changed now that we have 2 solid years of a baseline, almost pre-pandemic, to get to where we are here. The next spot that I'd call your attention to is now moving vertically to these bars. And I think the biggest opportunity is among those patients who are saying they've still never received a vaccine at a pharmacy. And it's probably unsurprising to think that there's a high level of comfort among those who did receive the vaccine at the pharmacy on the very far left. So unsurprising there that 84% of those that said they got a vaccine from a pharmacy in the last 12 months were also comfortable or very comfortable in getting that. Of course, there are some individuals that still just don't really like needles and don't like that process. So there still was 16%, although it is lower than what it was in 2019, who say they are uncomfortable, but yet they still report receiving a vaccine at a pharmacy. If we flip that, again, unsurprising that if you've never received a vaccine at a pharmacy, maybe there's higher likelihood that you're also uncomfortable for some additional reasons. So it is a larger percent that state that they are very uncomfortable or uncomfortable among those on the far right that are saying that they've never had a vaccine at a pharmacy. However, there is a higher percentage at almost 60% that are stating that no, they've never had a vaccine at a pharmacy, but yet they are comfortable or very comfortable in getting that vaccine. So there's still some opportunity there. And what we tried to learn from to shed a little bit more light on this challenge was a tweak that we made from 2019 to 2020, and we added a question. So among those who said that they were uncomfortable or very uncomfortable, we dug a little bit further. So that's where we were really stumped in 2019 to say, well, wait, we should have asked why, because we'd love to know what was the barrier to not having a higher degree of comfort. So we added that question and we asked, why were you uncomfortable with that? And I want to point out, if you look at this and you're starting to read it, if I can hear the gasps already as some surprises to what is listed here, this is a small percentage. So most people are saying that they are comfortable. So I don't want us to overreact and think that this is a large majority of the population. The vast majority, at least within our sample, is stating a high degree of comfort. But among those who are uncomfortable, I think it's very important for us to step back and try to understand that a little bit more to see if there's something that we can do to change that. In the first one, maybe it's a surprise, maybe it's not, but I know at least during flu season, it's hard not to go by a pharmacy and see some form of advertisement for it, whether folks are paying attention to that or not is another item. But the first most common response was that they didn't know pharmacists were qualified to administer vaccines. I think that's something that we can educate and provide some more exposure to help with. The other one was a little surprising. Do not trust pharmacists to administer. We didn't peel this back even further, but I'm sure there are a lot of variables that go into this. And it may just be they don't trust anyone to administer because they don't have a level of comfort with needles to begin with. But then the third one listed here, do not receive injections anywhere. So they're just completely against that topic. And then the fourth, pharmacies don't have a private or secure area. I think that's an interesting one. That's something that pharmacies can probably take some action on. But then again, maybe the environment will change so much as now with COVID-19 vaccines, I think the private and secure area is perhaps changing on the mindset or expectations of having that, especially when you have so many vaccines being administered in large parking lots at the dog park or arenas or stadiums. Perhaps that's maybe not as much of a concern going forward. So this is something that we would make forward for other or future surveys so we can see if this is changing as well. And then the last one, just to comment on there, is just didn't know that the insurance may cover that injection at the pharmacy. So I think that's another interesting one, especially for those on the payer side of things, and how you may push out some member education content, helping them understand that there are available options and channels to get that reimbursed through the pharmacy network. That could be another opportunity to reduce this barrier as well. So we just wanted to point that out because we thought it was a little interesting for the 2020 trend report. So as we had mentioned here for the types of pharmacies, this is that same assessment looking at no, never at a pharmacy, yes, more than 12 months ago, and yes, within the last 12 months. It's somewhat similar from 2019, but we wanted to break that down based upon the type of pharmacy they report using the most frequently. And I do want to point out that doesn't mean that that's where they got the vaccine. Perhaps it's highly correlated with that, but we just didn't want to have people think that that's where they had to also receive their vaccine. It's just that they had a vaccine at a pharmacy, not necessarily the one that they're reporting using the most. And we can see that there was a change, especially among those with grocery store with pharmacy, among the panel of consumers that we had used for this particular survey, and a very consistent trend, especially from those within the retail chain, among those within yes, more than 12 months ago, or no, never at a pharmacy. Those biggest changes seem to come among those who state that they received a vaccine within the last 12 months. The other thing that we wanted to look at was just the perception of the pharmacist today and how they view that role changing in the future. And so this is a lot of information here, so I'm just going to cover a couple of these. And if you look sort of top to bottom, where we start with this is 2019, and the darker green is what they view as the role today, and then the lighter green is the role that they viewed as being an important role or a future role in 2019. And then if we go to the shades of blue, which follows the green, The first darker color represents what they believe the role is today versus a future role. And similar to my opening comments, there's quite a bit of similarity among the various roles that we had listed for them. But where we call our attention to is where we see a bigger change from future versus today. And we did add a few additional response options in 2020 that didn't exist for 2019. And those are mostly at the bottom that we see there. Obviously, you don't see the green coupled with the shades of blue. That's because those were new response options that we saw. But to go back to my point on seeing the difference between future and today and where there's a larger jump, you can see that some of those really start to jump out at you at screening for referrals and also conducting health screenings. So both in 2019 and 2020, there was a pretty noticeable jump as a difference between a current versus a future role. And I think this is exciting to see because consumers are believing that there is a changing role for the pharmacist. And many of these future roles are things where the profession is moving into, investing into, or perhaps some are already there as it relates to pharmacogenetic testing and travel health vaccines, and also overdose protection, addiction education, etc. So just some interesting takeaways there in having a more advanced education role between today versus the future. So we did then ask a little bit more from the consumers to imagine this scenario where they were a patient diagnosed with a chronic condition. We listed out diabetes, high cholesterol, and high blood pressure. And we asked what their level of comfort would be with a pharmacist performing these tests and screenings at a pharmacy, and then how likely they were to receive these at a pharmacy as well. And again, we'll really look at this going horizontally at the bottom. And you can see that we have hemoglobin A1C, cholesterol, and blood pressure. And if we step back to think about the patient journey map or the experience map in the pharmacy, most pharmacies do have some sort of blood pressure kiosk or machine. And for that, perhaps there's a high level of comfort because they're used to seeing that in the pharmacy. So on the far right for blood pressure, you can see that there was a high degree of likelihood and also a high degree of comfort among those respondents. And then it does get a little bit lower as you go over to hemoglobin A1C for 2020 especially, but it's still really high. So not only are there a high percentage of respondents saying that they're comfortable receiving hemoglobin A1C at a pharmacy, they're also stating that they're also highly likely to do that. And I think that's the biggest takeaway here looking at 2020, especially for hemoglobin A1C, cholesterol, and blood pressure. While there are some differences across those three, and blood pressure by far is the highest, the others are still very high. So there's a high degree of likelihood and a very large amount of comfort. So this is a potential area where as pharmacists are investing and payers are thinking about potential reimbursement strategies, and then shifting into what I'll segue over to Emily for various value or outcome-based reimbursement. We already see that there's a degree of comfort and likelihood among consumers. So that's something we really like to see as we see where these models are evolving with some of our partners. Just as a teaser for you, if you'd like to go download the report, there is more that we cover in section 1, and we actually look at comfort with other types of screenings performed by pharmacists, and then also the level of comfort if the pharmacist was taking a more active or engaged role with changing doses or changing the medication themselves, and then how likely they would be to have a pharmacist perform some of these more advanced or different tests, I should say, for Hep C, flu, and pharmacogenetic testing. So something to take a look at. And with that, I will hand it over to you, Emily.
Great, thank you, Todd. Understanding the consumer perception of the role that pharmacy plays in the marketplace as a site of care is definitely extremely important and certainly telling on how the landscape is really continuing to evolve. In the second section of the PQS Annual Trend Report, we surveyed pharmacies to understand their perspective on how ready they are as a healthcare provider to meet the needs of both consumers and payers. So we'll dive in. Oop. There we go. So we'll talk first about the approach that we took. And we think it's important to understand the approach used within the pharmacy space so we can really validate the depth and breadth of the survey respondents and their particular experience and perspective of the industry, as we recognize there are differences in perceptions among pharmacy types, right? So to help achieve this goal of a holistic view, the survey was delivered to 35 unique pharmacy organizations, which collectively represented about 90% of all community pharmacies in the country. Now, in order to solicit feedback from such a large percentage of the existing pharmacy network, the survey was sent to national and regional chains, along with PSAOs, to capture the voice of independent community pharmacies as well. Now, within each organization, the survey was requested to be completed by the individual having responsibility for quality improvement or performance within their organization. And with such a wide net being cast, we were able to collect a total of 17 survey responses, representing about 45% of community pharmacies across the country. My mouse is sensitive, sorry about that. Now, when we take a little more granular look at the survey respondents, we find that the feedback was fairly evenly distributed among 4 main cohorts. And those are grocery stores with the pharmacy, retail chain or mass merchants, independent pharmacies, and then lastly, a group of respondents that chose not to self-identify. And also, as we mentioned, we requested that survey to be completed by the responsible party, and we were able to accomplish just that. The responses to the survey largely came from organization directors and managers with an average industry experience of over 17 years. So we really feel like we were able to engage a great mix of community pharmacy types and the right individuals therein. So let's see what the pharmacies had to say. So since the inception of tying quality measures and performance to pharmacy network contracts, as an industry, we've seen a wide range of adoption of differing contracting methodologies and certainly utilization of quality metrics. Now, these methods range from the use of process measures, which would be like generic dispense rate, intermediate outcome measures, which would be similar to the adherence measures, or outcome-based measures like managing A1C results for patients. And we wanted to hear from pharmacies their comfort level in the types of metrics used for accountability and reimbursement programs. Now, to accomplish this, we asked pharmacies to define their comfort level on which type of measure they would prefer or feel most confident in, linked to that financial component, and then followed up with some questions on 6 different scenarios to consider for reimbursement application. And here are the results. Pharmacies have consistently indicated that they were most confident in the intermediate outcome quality measures being linked to reimbursement methodologies. Now, we know these measures are more common in the marketplace than outcomes-based measures, and they truly do align with the common community pharmacy practice models as we know today. You can also see here on the far left that pharmacies were not a fan of only tying outcomes-based measures to reimbursement. However, it's most notably the largest difference between the 2019 and 2020 results that a higher proportion of respondents in 2020 selected that they would feel most confident with financial accountability tied to both intermediate and outcomes-related measures. Now, moving to the reimbursement scenarios. We asked respondents to answer, now if your pharmacy level performance was assessed according to patients reaching intermediate outcome or outcome-related performance goals, and corresponding reimbursement was applied, with what reimbursement frequency would they be most confident? And we see a consistent trend between 2019 and 2020, whereby pharmacies are most comfortable with the hybrid approach, which includes both a fee-for-service and a pay-for-performance model, and you see that at the very top. We also see consistency in the response that having an annual performance-based only reimbursement model provides the least amount of confidence among surveyed pharmacies. You'll see that at the very bottom there. Next, We moved to assess the capabilities and training needs to support outcomes-based measures and initiatives. And we did this in the survey via a three-part question. So first, we looked to understand the landscape of the pharmacy's current capabilities, specifically with respect to the patient's access through the pharmacy to receive various tests and biometric screenings. And we asked the pharmacies about their ability to quickly pivot operations to support new initiatives that would include outcomes-based measures and the level of training and education the pharmacies perceive to be required in order to support these measures. And here are the results. So when we first look at patient capabilities to test, this graph represents responses in 2020, indicating the current and future capability that patients have if they requested to receive testing for lab or biometric data. And the testing capabilities were specifically related to the three cohorts Todd had mentioned earlier: blood pressure, hemoglobin A1C, and cholesterol level. Now, for blood pressure on the far left there, the majority of respondents, 76% of them, indicated that patients have the current capability to request a blood pressure monitoring, and 65% indicated that they monitor blood pressure at the recommendation of the pharmacist. For A1C and cholesterol testing capabilities, the two cohorts to the right, in 2020, approximately 53% and 59% respectively said that patients currently can request a test at the pharmacy. However, 35% of pharmacies said patients do not have the capability to receive an A1C or cholesterol test. Unfortunately, no plans to support that in the future. So we have a high adoption of those that are ready and able to support their patients in that endeavor. There's certainly a cohort that is not quite up to par at this point in time. However, I think what's most interesting to note is the shift in responses to this question from 2019 to 2020. We do see capabilities increase significantly for the pharmacy response, indicating the capability exists at the request of the patient. For example, in the 2019 trend report, only 11% of pharmacies indicated patients could request a hemoglobin A1C in the pharmacy. And as you can see here in that middle column, that jumped to 53% of the respondents indicating that this was a capability. And likewise, for cholesterol, we see an increase from 26% in 2019 to 59% in 2020, where they are able to serve their patients with a cholesterol screening in the pharmacy upon request. Now, the time to support new programs, we asked the pharmacies if payers contracted with your organization to reimburse based on new intermediate outcome or outcome-related quality measures, how quickly would you be able to support this new initiative? And similar to the 2019 trend report, respondents most commonly selected they currently have the ability to support intermediate outcomes. However, the current ability to support new initiatives was a little lower in 2020 for both intermediate outcomes and outcomes-based measures, as more pharmacies indicated, and you can see this in the far right-hand column, they indicated a longer runway would be necessary to support any new initiative, regardless of measure type. And certainly, as we would all expect, this is probably the working of the pharmacies, working very tirelessly and successfully to really help our nation manage patients through the COVID-19 pandemic. Now, lastly, as mentioned, we assessed training needs for pharmacies, and we found that while many respondents indicated being somewhat or highly likely to contract with payers on new initiatives related to outcomes-based measures, organizations recognize the need for some additional training and education for pharmacists and their pharmacy staff. Respondents were asked how much additional training would be needed for their pharmacy staff to understand outcomes-based quality measures. And as you can see, most respondents, they're in the middle cohort, responded saying that training would be needed, and at least to some degree in both 2019, but an increase in 2020 at 59% there. We also see a really interesting decrease in the amount of respondents indicating that substantial training was needed when you compare the 2019 to 2020 trend report results. All right. So that's a summary on the pharmacy side. We're going to switch over here to payer in just a second. And as Todd walked us through the consumer perceptions of healthcare and how those intersect with pharmacy, we just spent a moment reviewing the challenging landscape in the pharmacy perceptions related to quality measures and patients' access to care within their walls. And our last stop in this trend report journey was to understand the payer's perspective by evaluating the challenges and opportunities that they face related to performance improvement. Now, just as we did for the consumer and pharmacy approach, we set out to cast the widest net possible by engaging 43 unique payers in the market, including national and regional health plans along with PBMs. 44% of those health plans kindly completed the survey, which represents about 70 million covered lives across our nation. And similar to the pharmacy participants surveyed, we asked that only the individuals responsible for oversight related to quality measures and value-based contracting efforts provide us responses on behalf of their organization. And so we're going to begin by understanding the types of value-based arrangements that our respondents supported in 2020. We'll get started. And we can start by sharing one of the most interesting evolutions of responses when we compare 2019 to 2020. And those are the responses provided from payers regarding outcomes-based measurement. Now, most notably, a difference in 2020 compared to 2019 was that 54% of the respondents in this second year indicated that they are responsible for outcomes-based measures, compared to only 29% of respondents in 2019. Now, perhaps this suggests that more accountability for patient-level outcomes is potentially increasing in interoperability within health plan organizations, and maybe that strategies to increase performance for outcome-related quality measures are perhaps becoming more prevalent. Now, next, respondents were asked to select which providers they have value-based or outcomes-based contracts related to quality measures. And respondents in 2020 indicated group provider practices and community pharmacies were the two most common provider groups that they contract. And this was, again, similar to 2019 results as well. However, you will note that the observed rates for these payers contracted with either individual providers and hospitals, that shows a significant increase from 2019 to 2020. Next, respondents were asked to indicate how frequently their organizations share performance status updates with their contracted providers. And again, similar to 2019, the majority of respondents in 2020 indicated they share monthly performance updates. However, in 2020, the responses, we see a decrease in responses indicating a quarterly sharing cadence, but an increase in responses indicating that weekly performance updates are communicated, suggesting that timely data is really of significance here. So now we understand some of the foundational elements of the value-based contracts and initiatives that our respondents provided. We wanted to really better understand the challenges that they face in these organizations related to performance improvement. Hang tight. Sorry about that. Now, respondents were presented with an initial list of 13 identified challenges, including an other response option. The list was developed through common challenges identified in published literature, other publicly available reports that had been commissioned by government agencies like CMS. Now, there were 3 different questions involving all or a subset of these challenges. And respondents were first asked to select all factors that represent their greatest challenge with performance improvement. And there are a couple of interesting findings in these results. In 2020, payer respondents indicated that not understanding which interventions yield the greatest impact was the greatest challenge. We also see less respondents indicating that provider awareness and understanding of quality measures was a challenge, and a similar decline in responses saying that aligning improvement across various external providers was a perceived challenge. Now, this may suggest that together we are bridging the communication gap and hopefully learning to speak each other's language a little more in 2020 compared to 2019. And part 2 of this question asked payers, which is the graph you see on your screen here, to identify which challenge they have been most successful at overcoming in the past 2 years. And interestingly, in 2020, the most frequent response indicated the most success in overcoming the ability to identify which interventions have the greatest impact, success in the lack of timely data, and also success in the inability to invest dedicated resources for performance improvement. And then part 3 of the question, actually, which is the graph here, is where we ask respondents to select which performance improvement challenges their organizations have been unable to overcome in the past 3 years. And I am saying this correctly, just as indicated in all of our previous conversations, payers attempting to understand which interventions have the greatest impact was the most frequent response, or tied for the most frequent response in both 2019 and 2020. So solidifying that the fact that payers have a really hard time understanding the impact of interventions is a challenge. It's an area that we have seen improvement, but it's also an area that we've been unable to improve. So quite a unique conundrum that we find ourselves in here with respect to understanding the interventions that are actually moving the needle. So other content covered in the payer section of the annual trend report, there are some additional questions in the trend report that assess payers further regarding some more specifics around value-based contracting and the involvement of community pharmacy in these potential arrangements. And I'm going to give you just a little more of a teaser than what Todd did to elaborate a little further, but we address the payer's perspective in support of engaging the pharmacy network for quality improvement, and we see a few compelling conclusions in this 2020
This is Amanda. Emily, can you hear us?
And this is Todd. I might be able to take over if we happen to lose Emily. And I think this is the transitionary slide anyway, so I think it's a good segue, even though Emily had some good points that she was making for a little bit more detail for the other areas that we have covered. There were some interesting takeaways, especially when you list out the types of quality measures payers believe pharmacies can influence. I think there are some in there that we would be maybe unsurprised to see, but also some that are a little surprising because there were some intermediate outcome or outcome, depending on how you make those definitions, measures that aren't very common in contracts today, but they are something that payers are rating a high degree of comfort with or interest to partner with pharmacies on. So we're seeing a shift because I don't think 5 years ago we would have seen the same responses, and that comes down to the evolution of measures that are used in those contracts. So if you don't mind, Amanda, if I'm also, here we go, perfect. So I'm going to transition into, and hopefully we can catch up with Emily at the end there and check to make sure she's good on her end. But what we wanted to finish with was sharing some of the concepts that we're looking at. We're probably targeting at least 8 to 10 different analyses across a pretty large data set to look for different trends in unique items from 2020 and the impact in the marketplace. So we have an opportunity at the end of this where we'd love to hear from you by sending us an email. And what we'd like to do is to just share a couple of the areas that we did some very basic or entry-level analysis for to get you thinking about what other options may exist. And really the point of this is to help you think of additional questions because we would love to hear from you. So as we mentioned at the beginning, we will have the odd number years for 2021, where it's the more qualitative or quantitative, data-driven insights. So as that, we listed 2 examples here. One thing that we were very curious about was the prescription utilization rates among pharmacies with a drive-through versus those that did not. And then we were also curious about antibiotic utilization during this time as well, because we know there are quality measures that relate to the use of antibiotics, especially in many cases where it ends up being a virus. So there's appropriate and inappropriate use of antibiotics. But then we also had some unique things last year with hydroxychloroquine as well. So we're talking about that. So lots of different areas we can go with that, and we'd love to hear from you. So what we have listed for the first area was wanting to understand or see if there's a difference with prescription utilization among drive-through and non-drive-through pharmacies. And this ended up representing just under 26 million unique member lives, so quite a bit of data that was used here. And based upon when we had segmented the data set, we were looking at a time period of January through September 2020. Much of what we were focused on is really towards the very beginning of the year anyways. So we thought it was appropriate that we didn't need to bring in the entire year to look at that. And I'll share a little bit more in a forthcoming slide what this means, but I'll talk through what would be on the legend. I didn't want to make the slide too small here so that we didn't know what we were looking at. So essentially you have obviously the green and the blue line, green line indicating prescription claims activity for or at pharmacies that do not have a drive-through, versus the blue line of pharmacies that do have a drive-through. And if you wonder how we knew if they had a drive-through or not, that came from NCPDP and looking at the database as of, I believe, the September-October timeframe as a snapshot, as there is an attribute or indicator in their database as to whether or not the pharmacy has a drive-through or not. And what we see in the blue, which is in between those dotted lines, is what's representing the first state. The very first dotted blue vertical line is showing when the first state instituted their stay-at-home order. The purple at the other side of that shaded blue represents when the first state removed their stay-at-home order. And then the green vertical line was when there was, I believe, the 44th state, which was the last state to implement a stay-at-home order. So it just gives you some context during that period. And we didn't do any statistical testing on this. It's just purely observational for what we've seen. But if we look at around 11 million coming in on a weekly basis with a data set that had a pretty significant drop over the weeks that we are listing here compared to those with a drive-through, you can see that the impact was really across both. And it was about a 20% drop that we see among those that didn't have a drive-through and about a 17% drop for those that did have a drive-through. So maybe there's something there. This is something else we'd like to explore a little bit further, but it does seem as if the impact was relatively consistent among both of those types of pharmacies or service offerings, I should say, that the pharmacies would have. The other, very quickly, talking about antibiotic utilization. So again, looking at a pretty large aggregated Medicare data set, our focus was on outpatient antibiotic use. And we were looking year over year to see if there was a difference in those antibiotic utilization. In 2019, it was a little over 25 million individuals. In 2020, a little bit higher at 26.5 million lives that were represented for prescription claims activity. We used some pretty standard definitions for antibiotic utilization with a database from Wolters Kluwer. And we had a time period of looking at the full year, January through December 2019 versus 2020. So a big drop here, probably not a surprise, but we thought the best way to characterize the change was looking at a baseline and then percent change from baseline. So we started on week 4 and we looked at what was the antibiotic claim count in 2019 and 2020. That became our baseline. And then each week that went thereafter, we looked at the percent change in that year compared to what that baseline was in week 4. So you can see in 2020, there was a pretty drastic drop of antibiotic utilization. So this has our mind spinning on all sorts of different things for us to look at. But since this was such a large drop compared to what usual care or what usual utilization would have been for 2019, it's a pretty significant drop, but we do see it start to trend upwards. But our main focus, of course, was looking at through the first 20 weeks of the year. So the other things that we wanted to think about were just relative to certain antibiotic classes. Were there some specific classes that saw more of a drop or an increase versus others? Was there some better performance, almost just how the chips fell or by chance because of lower utilization? So was there higher performance on those quality measures that relate to proper/improper use for upper respiratory tract infections and antibiotic use. And then we also were very interested to look at hydroxychloroquine utilization and the potential to potentially look at some predicted drug shortages. And the main focus area there is, of course, looking at past utilization of patients so that we can see who the chronic users of hydroxychloroquine were versus those who may have had it newly prescribed in a certain time window in 2020 that may have been using it for more acute purposes. So there are lots of ways that we can go with this, but we'd love to hear from you. So if you would be so inclined, or if you'd like to send an email to trendreport@pharmacyquality.com, we'd like to hear some ideas that you have. Maybe there's some brand new areas that we didn't even cover that you'd have some interest to see if there were some changes in utilization or impact on certain measures as it relates to some occurrences that took place in 2020. We would love to dig into that a little bit further. We have a large list, but hearing from all of you would help us narrow down to ensure that we're sharing and delivering some insights that also relate to the most value for you as well. So with that, certainly thank you for your time. We'll open it up, and Amanda, I will send it back to you. I think Emily is with us. I just heard from her. So hopefully we can field some questions, but we do have our email addresses there. And I do have a link that we put in here for the trend report when the slides are disseminated afterwards. And I'm sure, Amanda, you can speak to that, but we wanted to make it easy for you to download that trend report for you as well. So appreciate your time. And Amanda, I will hand it back to you.
All right, thank you both to you, Todd, and to Emily as well for sharing the trend report, all of your work and insights with us today. We do have a few minutes here for questions. I wanted to remind the audience, if you do have questions, to put those in the questions panel, and that's on the right side of your screen. I'll go ahead and start with a couple that we've got here already. There was one question wondering about utilization of outpatient pharmacies versus mail order. So Todd or Emily, do we have either any Medicare utilization data or commercial utilization data that showed any differences in mail order versus in-person pharmacies, if you will, like before and after stay-at-home orders were issued earlier this year or earlier last year?
I think that's an excellent idea for us to take back. We didn't look at that. This was the only two that I listed here was just very initially kind of a cursory take at this just for some initial concepts, but knowing that there also is some publicly defined pharmacy types or dispenser class codes, as it's called, we can easily look at that to see if there is a change in utilization based upon type of pharmacy as it's defined by NCPDP, or I think it's the ResDAC database. So we'll definitely add that to the list. So I don't know the answer to that, but I think that's a great one for us to add. So I thank you for the question.
Okay, sure. Thanks, Todd. Next question we had is related to reporting out of A1C and blood pressure values in the pharmacy. So I was wondering if you might be able to talk a little bit more about that as far as how easily we feel that pharmacies would be able to provide those services to patients, and if we really have a lot of capacity to capture that information at the pharmacy level. The trends and the possibilities in the future are really interesting around those two topics. So either Todd or Emily would be interested in further comments on that.
Okay, well, I can share just a little, that Emily, I'll hand it over to you. I don't want to speak too much on behalf of the pharmacies. That's really what the purpose of the survey was, and maybe this is another item where we add for the next 2022 trend report to ask the pharmacy partners their thoughts on this. But I think this is something that will probably be operationalized differently depending on who the pharmacy is or what software they're currently using, and if that's something that fits within workflow. There are many groups that have either built their own, or maybe they contract out for their pharmacy dispensing software that may already have some capabilities, but maybe they're not turned on per se. But that really depends to an operational workflow process most likely. But I think it's something that could be captured, but a lot of it comes down to, is there also reimbursement for that, if that's going to be a provided service or if it's going to be something included in the contract. I think if there's the follow the dollar, if there's a value chain that can be provided there for reimbursement, then there likely could be an opportunity for that that will to find a way to input the information, since that's certainly a rapid point of care test opportunity that pharmacies have, or many have, that they can input that in to a software that may or may not already exist. So those are my thoughts. Emily, any thoughts from you?
Yeah, just, can you hear me first and foremost?
Yep, we can hear you.
Okay, great. No clue what happened, and my apologies there. Just to add, I think there's a lot of opportunity and potential in this space, but it will be a collaboration or a collaborative effort amongst pharmacy providers and health plans, and trying to understand what that data exchange looks like. It definitely feels as if it is a true possibility, but as you had mentioned, Todd, understanding program design elements, reimbursement structures, and things of that nature, that's going to take some sincere collaboration across all parties.
All right, thank you, Emily and Todd. I think we've got time for one more. And this last question is, do you anticipate that the capacity of pharmacy to take on new value-based initiatives, are we going to see that rebound post-pandemic, or do we feel like pharmacies are reaching service capacity with what they're doing already in those existing initiatives?
Well, I'd say from my point of view, I think there's a lot that's still open right now with the pandemic. I think a door is open for more opportunity. The spotlight that pharmacy has now, while no one wants to be in a pandemic or having gone through a pandemic, I think there's a renewed focus on understanding what potential versus current role may exist with community pharmacies. So I understand that many are scaling up for hiring so that they can have more capacity to administer those vaccines. How that plays out afterwards, I really don't have the crystal ball to share what that might look like, but we know that it's highly likely this is going to be an annual vaccine. So overall, vaccine need is higher than it would have been certainly the prior year. So this is going to be a large focus. I think there will need to be continued staffing to support those needs. And what groups do with the supply and demand of not only the vaccines, but additional services that may be layered on top of that is what we will have to wait to see what plays out. But I think there's at least additional resources being pumped into pharmacies. So as that couples into potential changes in value-based reimbursement programs and outcomes, if that's the interest and desire for where they'd like to go, I think there can be some capacity that's maintained to support those programs, since there's some new momentum in that area in light of the pandemic. Those are my thoughts. Emily?
Yeah, I actually don't have any additional thoughts there. I think that this is a really interesting point in time, and do hope that that's how things come to fruition, that there are additional resources as pharmacies continue to play a really important role in the pandemic and helping to get us on the other side of that. So just agree with your comments, Todd.
All right. Thanks so much, Todd and Emily. We appreciate you joining us today and for your thoughtful answers to those questions. That's all the time we do have for questions. I did want to remind the audience that the PQA annual meeting is coming up. It will be online from May 11th through the 13th. We're going to feature about 36 speakers and educational sessions this year who will address top issues and emerging trends in topics like medication quality, measure development and implementation, care transformation and technology. Registration is open now, so do please make plans to join us online at the annual meeting. And then we've also got 2 PQA events coming up in March. The first is going to be our stakeholder advisory meeting that's open to PQA members. PQA staff during this meeting will share current and relevant measure development and maintenance updates, and that will include the status of measures that are in development and also recent updates on existing measures. So keep an eye on your email, or you can also visit the Member Resources Library on PQA's website for more information on that meeting. And then our next Quality Forum webinar is going to be on Thursday, March 18th, and that will feature a presentation on the evolving role of pharmacy and pharmacists and the future of pharmacy. So we talked about that a little bit today and heard from Emily and Todd on that. And next month, we're going to be joined to explore that topic further. George Van Antwerp will be with us from Deloitte Consulting. He's going to share insights from Deloitte's Future of Pharmacy report and also some near-term implications for both clinical and retail pharmacy. So please make plans to join us for that as well. And then I would like to remind all attendees to please answer the brief survey that you will see as the webinar concludes. And then one more reminder that the recording and the slides will be distributed within the next week and made available on the PQA website. Thanks to everyone for attending, and we hope you have a great day.